Hello.
Jackson? Hi, it's Marianne, the nurse again. I took your EKG that we had done in triage, and I took it to the physician in the ER and had him look at it. And it does not look at this time like you're having a heart attack. Okay? So that's a good thing. So it's not actually your heart tissue or muscle, but something is not right because you are, having these sensations of pain in your chest. So one of the things that we have to continue with is our triage note. You comfortable with answering some of my questions?
Yes.
Okay, excellent. I need to kind of talk to you about your chief complaint about the chest pain and how it came on.
Well, I went to lunch with some coworkers, and we went to Eddie's Sports Bar, and
Okay.
It was dead, and then it was dead, and then a lot of people came in, and that's when I kind of started noticing that there was this sensation in my chest, with my fingers starting to be numb, and then my chest, and then it started hurting. I could feel with every beat, it just started aching.
It was an achy type of pain?
And stabbing. I was really disoriented. It's never nothing I'd ever seen before or felt before.
Did you feel hard, was it hard to breathe?
Yeah.
Okay, so you felt shortness of breath. And it all started when there started to be a lot of people kind of coming in?
Yeah.
You feel like you're kind of overwhelmed?
Yeah.
Okay. And you're with friends or family?
Just some guys I work with.
Okay. The last thing that we do on our kind of triage screening is called an audit C test. And it's just a alcohol use disorders test that we use, and we screen everybody. Can we talk about your alcohol use?
Yeah.
Okay. How often did you have a drink containing alcohol in the past year?
A lot. A lot.
So I'm just going to go over some answers with you so that you can pick which one is a lot to you. Never, so that doesn't count. Monthly or less. 2 to 4 times a month. 2 to 3 times a week. 4 or more times a week.
It's 4.
4, okay. How many drinks did you have on a typical day when you were drinking in the past year? So the scoring kind of here is none, 1 to 2, 3 to 4, 5 to 6, or 7 to 9.
I'd buy a bottle and I'd just sip on it throughout the day, and then at night I'd buy a case of beer and I'd just finish the whole thing.
So the 4 here is 10 or more, so would that qualify? Okay. And that was daily?
Yeah.
Okay. And then, so how often did you have 6 or more drinks in one occasion in the past year? Daily or almost daily?
Yeah.
Weekly? Okay. All right. And you still drink that
No.
much? Okay.
My pastor brought me back into the church, and I've been sober for about 10 months now.
Wow. Okay. Great. I'm gonna, with the Audit C test, whenever anybody is positive, we always call in one of my colleagues to come and talk to you. And it sounds like you're on the right path with your pasture, especially since it's been 10 months. That's a long time to be sober, so congratulations on that. But something's obviously still going on, so I'm gonna contact my colleague, Alexa, and she's gonna come in and talk to you just about the results with the audit. Is that okay with you?
Yeah.
Okay. Thanks, Jackson.
Hello?
Hi, Jackson. It's Marianne again. This is Alexa. This is the colleague that I was telling you about. She's going to come and talk to you in regards to the audit test. So I'm just going to give her a little bit of information about you. Jackson is 10 months sober, but he did score a 4 on his first question of the audit C because there was a time where within the past year, that he was drinking 4 or more times a week.
Okay.
today he had a little bit of a problem. Well, he had chest pain when he was at lunch with his friends at a bar-like setting. And so that's why he came in. So Alexa's just going to ask you a few more questions, Jackson, okay? And then when she's finished, I'll come in and we'll finish up. And the physician will come in with me and we'll go from there.
Okay.
Okay, thanks.
Okay, thanks, Marianne.
Thank
Hey,
you.
Jackson. So okay if I sit down?
Yeah.
Okay. How's it going?
Going good.
Okay. Well, Marianne filled me in a little bit on what brought you here, and she had done the first 3 questions of this alcohol use disorder screening test that we do. And so she had wanted me to come in and finish this and then talk to you a little bit. So are you okay with that?
Yeah.
All right. So she had asked you these first 3 questions, and I'm going to pick up here with number 4. And so you can see them here. You can see that for most of these questions, the responses go from never, less than monthly, monthly, weekly, and daily or almost daily. So just keep those in mind as we go through these. Okay? All right, so you can see here, this question asks you, how often during the last year have you found that you were not able to stop drinking once you started?
Daily.
Daily? Okay. Okay, thank you. Number 5 asks, how often during the last year have you failed to do what was normally expected of you because of drinking?
Weekly.
Weekly? What kinds of things would you not be able to
I
do?
just, my memory just kind of went off, and I was just forgetting to turn things in at work.
Okay. Did you ever get, like, written up or anything?
No.
Okay. And you kept your job?
Yeah.
All right. Okay. Thank you for sharing that. Number 6 asks about, like, how often during the last year did you need a drink in the morning to get yourself going after a heavy drinking session?
Never.
Never? Okay. All right, thank you. How often during the last year have you had a feeling of guilt or remorse after drinking?
Weekly.
Weekly?
Yeah.
Okay. Do you want to just share anything more about that?
I mean, when I was drinking, I wasn't really around people that cared, but now that I'm sober and with people that do, I do feel a lot more guilty.
You do?
You know, the drinking just kind of numbed it, but I always knew there was something wrong, so.
Okay. All right. I'm going to mark that here. Okay. And then, thanks for sharing too and for being honest. I appreciate it. This next question asks, how often during the last year have you been unable to remember what happened the night before because of drinking?
One or two times a month. Yeah.
Okay, 1 or 2 times a month. I'm just going to mark that and then mark this here. Okay. And then number 9 asks if anyone, or have you or someone else been injured because of your drinking?
No.
No? Okay. Okay, and finally, number 10, has anyone in your life, a relative, friend, doctor, anyone else, expressed concern about your drinking?
My pastor at my church was the one that confronted me initially. And he's the one that got me in a facility out of state.
Okay.
And has been helping me with recovery since.
How long were you out of state at the treatment program or
3
facility?
months.
3 months? Okay. When did you get back?
I got back, I think that was in the fall.
All right.
So I've been back since, yeah.
Okay, so like maybe 5 months since you got back? Around
It's
there.
like 6.
Okay, more like 6. All right. And you, have you been sober that whole time?
Yeah.
Nice job. I want to talk a little bit about like what's keeping you sober and what kind of support you have. Before I get in that, I just wanted to share a little bit about alcohol education. I know you're not drinking, but sometimes people don't know that there's recommendations that are put out in terms of how to have like safer drinking or what not to exceed, and also what a drink even means. And this is what a drink is, like 12 ounces of beer, 5 ounces of wine, 1.5 ounces of liquor, like a shot. You likely exceeded the number of drinks that are, considered to be safe or lower risk for a man your age. So typically for males, it's not recommended to go beyond 14 drinks per week.
Oh.
So, yeah, what do you think about that?
I was doing good enough for 3 people, I guess.
3 people? Yeah. Yeah, it sounds like if we added it all up, it would definitely be more than 14 per week. So the fact that you've been able to get sober and maintain your sobriety is excellent. Because there's long-term health impacts. It sounds like part of why you came in here today was related to anxiety potentially. Wasn't a heart attack, correct?
Yeah.
And so I wonder if there are some things you could do to try and decrease your anxiety, if there's anything you're doing now that's been helping.
So we're going to church pretty much every day, doing
Church.
those meetings.
Okay.
I do like a private session with my pastor once or twice a week.
You do.
I think the real problem is that my ex-girlfriend's father died about 2 months ago, and I've been kind of like talking to her more and more, and we've actually met up a few times, and and I still care about her a lot, and I miss it, but it just makes me want to drink more.
Okay, so you're missing her. She's wanting your support right now, but it sounds like it's hard to give it to her.
It's just like about having a really good time with her. Like, that was all it was about, was having a really good time.
Like drinking and partying and, okay.
Pretty much.
Is she still drinking?
Yes.
Okay. That would be hard to be around.
It's hard to walk away from too.
Yeah. And that's stressing you out. Yeah. Okay. I'm glad you're here. Do you have a sponsor?
I do.
You do? Is that someone you feel like you're building a relationship with?
There's a big age difference. He's younger than me, so I need to find a new one.
Okay.
I just don't know how to tell him.
Is that stressful too?
Yeah.
Okay. You're doing awesome, and you're safe, and you're here, and you are just making a lot of really positive steps towards being sober and maintaining your sobriety despite all the stressors that are going on. You haven't had a drink, and that's really commendable. I'd like to help you find ways to ensure that you are going to be able to maintain this. It sounds like you really would like to have some additional sober supports or someone really close to you who's sober. Something I wanted to bring up is maybe having you talk to a psychologist that works here at the hospital with me. His name is Dr. Fitterling, and he meets with people when they're experiencing different things, including anxiety, which it sounds like might be what's going on with you, and that might have be brought on like the feeling of having a heart attack, and it wasn't. But he does work with people, and I could have him contact you if you'd be interested in having more like long-term meetings with him.
I had panic attacks before.
You have?
Yeah, and it was nothing like this one. And yeah, I'd really like to talk to him.
You would? Okay. And I believe Marianne has your phone number and stuff, so I'll get it from her if that's okay.
Okay.
So in the meantime, because it might not be immediate that he contacts you, hopefully it'll be within the next few days. But between now and then, is there anything, could we make like a tentative plan about what's gonna, I guess, help you like maintain the steps that you've been taking?
I'm gonna get my pastor to come pick me up.
Okay.
And I'll stay with him.
Oh, you will?
Yeah.
Okay.
I've done it before, so I'm sure it'll be okay.
Okay.
And
just taking notes.
yeah, he'll take care of me from here, I'm sure.
Do you have any meetings lined up in the near future?
I'm sure we can go to one today.
Today you can get to one? Okay. Is there anything else that I can assist you with today, or do you have any questions?
No, I'm just glad it wasn't a heart attack.
Yeah, me too. and I'm glad you're here. And again, nice job on your sobriety and taking steps to be healthy. I know there's a lot of stress, but getting in with Dr. Fitterling and having someone to help you more long-term might be really beneficial for you. So thanks for being open to that. Let me know if you need anything. I'll be around the hospital.
Okay.
All right. I'll get Mary Ann the doctor, and hopefully you can go soon. Have a good day. It's good to meet you.
Yeah.
Bye.
This is Dr. Fitterling.
Hey, Dr. Fitterling, it's Alexa from the hospital.
Oh, hi, Alexa.
Hey, I have got a new referral for you, and his name's Jackson. His patient ID number is 12345. He came to the hospital today, to the ER specifically, after thinking he was having a heart attack, and after, getting checked out, it looks like it was probably more related to anxiety, and he does have a history of panic attacks that he reported. So I met with him today for about 15 minutes. He is interested in meeting with you for longer-term treatment and services and support, and I did get his permission to contact you to give you some background info and let him know that you would then be in touch in the next few days in order to try and, establish contact and meet with him in the near future.
Okay. And so he's seeking long-term therapy with a psychologist for what target behaviors, or what is a particular interest?
So he has a history of alcohol use, and he's been sober now for 9 months. And he went to treatment out of state. He's been back. He's maintained his sobriety, but he's experiencing some anxiety. There's myriad stressors. He's got some stressors related to his ex-girlfriend who's still drinking. And it's hard for him to be around her, but she's wanting some support right now for her own things happening in her life. He would like to find a new sponsor because he is in a 12-step program, but that in of itself is kind of stressing him out, that he needs to break it off and find someone new. And just in general, being around people who are drinking is that was related to what happened today, that's just stressful. So he wants to maintain his sobriety, manage his anxiety, and was really open to my suggestion that he meet with you in order to gain some skills and get some more support.
Gotcha. So he needs a connection between sobriety maintenance and dealing with his anxiety.
Yeah, he
Good.
seems to be.
Okay. All righty. Is there anything else I would need to know before I give him a call? I'll look up his contact information in his record there, and also I'll review your progress report, your progress note, to get any further details I might need.
Okay, let me know if you need anything else, and thanks so much.
Okay. Thank you, Alexa.
All right. Bye, Dr. Federling.
Bye-bye.
Bye.